Being a caregiver is already a difficult job, but caring for someone in the age of the coronavirus brings about a whole new list of things to consider. How do you provide care without unknowingly spreading the disease? And what can caregivers do to protect themselves right now?
We know professional caregivers are concerned, but so many caregivers are not professionals. Their family, their friends, their neighbors. So we're getting a little advice today.
Yeah, Bill Walsh is AARP's coronavirus response lead, and he says what's going on right now just makes the job of a caregiver all the more difficult. Listen to what he had to say.
Well, it's exacerbating the tasks that they have to do every day. It's also exacerbating their stress. Look, we're combating the coronavirus, but we're also combating fear, anxiety, and isolation. This is particularly true for families with loved ones in nursing homes and assisted living facilities, many which have essentially closed their doors to families in order to isolate their residents from the virus. We understand the public health concern here, but those facilities must open lines of communications between the residents and their families. And they are obligated to give those families updates on a regular basis about how their loved ones are doing and what's happening inside the facility. This is a time, if you're a caregiver with a loved one in a facility, to be a strong advocate for them.
You really are the watchdog when it comes to making sure that the facility is doing the right things all the time, but especially now.
Yeah, and one of the things that makes it even more difficult now is some homes aren't allowing visitors in at all, so you can't see your loved one. And then if you're caring for that person at home, you can't stay 6 feet away from them with social distancing.
You're there, you're right there.
I mean, you've got to sometimes help them eat, sometimes help them bathe. So there's a lot of close contact there that you have to consider.
So his next point is about making sure you have a plan if someone gets the coronavirus. Try to identify backups and people who could step in to help.
The most important thing right now is make a plan, right? In case you get sick, in case your loved one gets sick. A plan can include things like identifying family and friends who can take over some of those daily tasks if one of you falls sick. What are the local services in the area? What about food delivery and prescription drug delivery? These services are available more now than ever, and prescription drugs are really important. Get a list of those prescriptions that your loved one is on and try to get a 30-day supply. That's what the Centers for Disease Control is recommending, and we think that's a really good idea.
It is a really good idea.
Yeah.
And the thing that I wonder about is if the caregiver is exposed to COVID-19 and then that caregiver needs to be quarantined, who steps in to help the patient? So they can't keep working. They might expose the patient at that point. So his whole idea about making a plan of who would then take charge is really important.
Very important.
So again, thank you to Bill Walsh. He is the coronavirus response lead for AARP. Some really great information.
Yeah, and there's even more info if you want some at their website. And we have a link for you at pittsburghtodaylive.com. They even have a tele-town hall that's planned for today at 1 p.m. to answer your questions.
Yeah, and our thanks to AARP for providing this important information to many families in our area at this time.